Once again, you are welcome to this class. This is a continuation of lessons from the course HS2 titled Demography and Social Statistics in Public Health. And today we are continuing with lesson topic 5 titled Population Mobility and its Health Consequence. The last time, all remember, we talked about health needs and health planning. And then we saw the two aspects where we discussed number one, assessing health need based on demographic data. So about integrating demographic factors in public health planning and policy. And then we saw how demographic data had on health planning. Today, in continuation, we're looking at population mobility and its health consequences. As an overview, population mobility is defined as the movement of people between different geographical areas. It plays a significant role in shaping public health outcomes. And this concept encompasses both internal migration, which means movement within a country, and international migration, movement between countries, influenced by economic, social, political, and environmental factors. So we are saying that mobility in terms of population is as a result of economic matters, issues, circumstances, social, political issues, and also environmental factors. So understanding the impact of population mobility is crucial for public health practitioners, as it directly affects the health of individuals and the community. What are the objectives for this particular study, this particular lecture that we are taking? By the end of this lecture, we should be able to define population mobility, should be able to explain the significance in public health, should also understand the demographic migration trends and the impact that they have health. We also need to understand how to analyze the public health consequences that are associated with population mobility. And finally, we will discuss such that you'll be able to know the role of migration in the spread of diseases and the effect of healthcare system. The effect on healthcare system. So let's go down into the discussion in detail. Now, we can see that population mobility is very important, and so these objectives are key objectives that you must take cognizance of. Now let us see population mobility and the effect on public health. Now, population mobility actually refers to the movement of individuals or groups from one location to another. And this movement can be internal within a country or international across a country, across countries, I mean. And there are key drivers of population mobility. There are certain factors that indeed bring about this mobility, that causes this mobility. Economic factor is number one. Political and social factors number two. Environmental factor number three. And health issues. So let's take them one by one. Economic factors. This is a situation where people often search of better economic opportunities, such like job prospects and improved living standards. And this economic migration can be seasonal. Sometimes agricultural work can take from one place to another, or long-term due to structural changes in industries and impact on the economics. Now, when economies have certain challenge, people move from that economy to another economy. That's in terms of country. And when industries are shut down, it affects a whole population. Perhaps over 1,000 workers come from that particular population. So when it is shut down, of course, what that means People need to work and to take care of their life and meet their basic needs. So they migrate to another position, another part of the country where the opportunities are bound. That way, ability is affected by economic factors. Number two is political and social factors. Political and social factors. Migration can be driven by political instability, conflict, persecution, or lack of social opportunities. For instance, people fleeing conflict or war often migrate as refugees to escape violence, to escape oppression. Let's also see environmental factors. Environmental factors or environmental changes such as climate change, natural disasters, or land degradation can force people to migrate. And when they are forced to migrate, they are doing that because they are in search of safer living conditions where there will be no earthquake, where there will be no conflict, war, and so on. So they will migrate. It's essential. They have to. It's not a matter of whether you are convinced. They have to, because they seek these things that are not available in their own population or in their own country. Finally, let us see health issues. Some people migrate to seek better healthcare services, especially in countries or regions where access to medical facilities is very limited. So migrants may also leave areas where the healthcare infrastructure is inadequate for managing specific health conditions. For example, have access to cancer therapy treatment better off in Abuja, and instead of staying in Lagos and traveling to Abuja every 2 weeks, to migrate. The person goes to Abuja, rents an apartment there for the sake of his health, and access the health center there. And this originally is as a result of what? Health issues. So let's go further and see the key concepts. Now, what key concepts are we looking at here? We are looking at the public health implication. You know, migration is not just a demographic phenomenon, but a health issue that impacts disease transmission. It also impacts access to health care and also the overall well-being of migrants and host population. It has general effect. So movement can introduce new diseases to a population, like I've told you, can cause strain on healthcare system and increase the spread of infectious disease. So this is a key concept, very strong key concept. And so access to healthcare is very important for cases of population mobility, and the consequences must be mitigated so that it doesn't become fast spread and without control. So let's move to the next one, demographic migration trends and their impact. So this is the second subtopic under lesson 5. Now, demographic migration trends and their impact. So we'll be seeing types of migration as we discuss this demographic migration trends. Now, internal migration is one, then international migration is the other. Now, for internal migration, this involves movement within national borders. Common patterns in rural to urban migration, driven by industrialization and urbanization, like I've told you, in search of job prospects. In developing countries, such migration is often linked to overcrowded cities. So you see people moving to the city where everybody is moving into, because that is where you find prospects. A lot of companies, a lot of opportunities, jobs are there, need to make money and send back home, and so on. Insufficient infrastructure and inadequate healthcare are reasons why people leave where they are to the city. So that's internal migration, from within the same state, moving from one city to another. Now let's see international migration, movement across countries. That's what this refers to, and it's often to economic opportunities, like the Japa syndrome. It can also be as a result of political asylum. Somebody's, they're going oppression, government is trying to aim or target a particular politician or activist. It seeks asylum in UK, in England, and then he moves. And they will accept him, save his life, or perhaps search for safety. Migrants such as refugees and asylum seekers, they face unique healthcare challenges, legal and cultural barriers. So when they get there, it's a new place. So there will be legal barriers, there will be cultural barriers, alongside trauma from their experiences, and this needs to be catered for. Let's see the migration patterns. There are two types of migration patterns: a rural to urban migration and cross-border migration. Okay. Now for rural to urban migration, this is the most common form of migration, and it is driven by better job prospects and access to healthcare. It often leads to overcrowding in urban areas where slums emerge, and healthcare becomes a challenge due to poor sanitation and limited resources. In cases of cross-border migration, rural to urban is simple, move in the same rural community or the same country, the same state, rural and simple. But for the cross-border migration, refugees fleeing conflict or political persecution often face health risks such as inadequate healthcare access, trauma, spread of infectious disease. Now, the host countries often will have to struggle with adequate healthcare this large displaced population. So, perhaps there's a country that is having crisis, there's civil unrest, there's war. Now they get to the border to the next country. Now, until you get to that border, you are not safe, because within the country there is a civil unrest, there is a war, especially when it's a national type. But when people move to the border with another country, nobody has the right to cross that border and fight into that border. So the border can open up, the other country can open up its borders to save lives. So you come in, but they will check to ensure that rebels and enemies don't come into their country. So that's about the types of migration. Now let us see the population projections and health systems. Population projections and health systems. Impact of population structure is one aspect that we are going to cut. What is the impact of the population structure? Because when you want to project you want to make a population projection and you want to look at the impact on the health system, you must consider the impact on the population structure. So you want to confirm that, you want to look into that. So in looking into that, migration affects both the origin and destination areas. It affects where you are coming from. It also affects where the people are moving to. Now, the arrival of migrants may strain healthcare systems, especially in the urban areas that might not be prepared to handle a large influx of people. Remember, the war is sudden. There's no place where they announce and say we'll start the war on Tuesday. So it comes suddenly. Somebody tries to take the upper hand and comes as a surprise to the opponent. And so they are caught up in war. And so that way the other country probably were not prepared. And they have to help. So they have to open up the border by agreement or by international treaties. They open up the borders and people come in, and then they have to start looking into what to do at that time. Usually there are procedures, there are processes that are put into place originally for such a situation. So that is that about impact on population structure. Let's look at the healthcare strain. Now, this high population mobility can lead to health systems becoming overburdened, resulting in challenges in delivering basic health services, such like immunization coverage. Then you have chronic disease management. So, in making a population projection and health system, you have to look at the impact of population structure. So, you have to look at the healthcare system, how strenuous will it become, of the pressure that will be mounted following the increase population that is coming in. So it's important that that is considered, because it will have a long way a long impact on it. So that's that. Now let's see the third one, which is public health consequences of population mobility. Public health consequences of population mobility. Now we'll start with health challenges in migrant populations, and then we'll now look at public health implications for countries, public health populations for countries. So let's start with health challenges in migrant populations. Here we'll see increased vulnerability to disease. Those are one of the challenges. Number two, we're going to see that they have psychological stress. Number three, the other challenge is that access to health, and then also look at the increase in demand on health services and the spread of non-communicable diseases. Now, in detail, increased vulnerability to disease is one, like I've told you. Migrants, particularly refugees, they may carry infectious disease from their areas of origin. Diseases like tuberculosis, malaria, and HIV and AIDS can be more easily spread in migration settings due to the overcrowding and sanitation. Psychological stress is also one of them. See migration, especially under duress, and can lead to mental health issues such as anxiety. A lot of them have depression, and you see post-traumatic stress disorder following the wars, bombing and killing, life killings that they've experienced in their country before migrating under duress to another country. Now, the experience of trauma adapting to new environments and also economic hardship can really escalate and cause more mental health problems. Let us also see other challenges or consequences, which include access to health care. Now, these migrants often face barriers. Yes, they face barriers to health care, including legal restrictions, language barriers, and lack of awareness about the healthcare systems. Now, these challenges can lead to delayed diagnosis, which is dangerous, untreated health conditions, which worsens the matter, and a high prevalence of chronic diseases in migrant patients. Good. So let's look at the next one, which is public health implications for countries. One of the public health implications for countries is increased demand on health services. An influx of migrants can significantly increase the demand for healthcare services, and in many instances, health systems in receiving countries are not adequately prepared to handle the health needs of those migrants because it happens suddenly. They are not yet even fully done in taking care of their own. When sudden issues like this happen, and then people migrate in their large influx. Now, the second problem or implication is that the spread of non-communicable disease. Migrants may bring them a higher prevalence of certain non-communicable diseases such as diabetes or hypertension, which can overwhelm the healthcare systems of these host countries, and that are not, these host countries are equipped, fully equipped. They don't have more than enough now cater for themselves, let alone for the additional citizens. I mean, the additional refugees or people who are seeking asylum are coming into the country, and so they are not equipped to address these conditions. Okay, so let's see the next one, the impact on population health indicators. I told you about the indicators, key indicators that help you look at what and what are to be considered. Now, the impact on population health indicators. Let's see mortality and morbidity, and then we look at cultural and behavioral shifts. For mortality and mobility, we know that migration can affect health outcomes in both origin and destination areas. For example, rural to urban migration is often linked to higher rates of respiratory disease, waterborne diseases, and malnutrition due to poor living conditions. Under cultural and behavioral shifts, we also have migrants may adapt unhealthy behaviors, because when they get there, in order to want to conform or survive, see them adopt unhealthy behaviors in their new environment, such as smoking to forget their sorrows, like they say, poor dietary habits. These changes can increase the prevalence of lifestyle related diseases such as cardiovascular disease in both the migrant populations and then very soon becoming transmitted in host communities. So that is that on the impact on population health indicators. Quickly, let us see number 4, subtopic strategies for addressing the health consequence of population mobility. Now, improved screening is one of them, and the other is better integration of these migrants into the healthcare system. And finally, community-based health intervention. Let's look at them one by one. Now, for the improved health screening at migration points during the borders or at the airports can help to identify and prevent the spread of infectious diseases. Now, this is particularly important in regions with high disease prevalence, such as tuberculosis and malaria endemic areas. And so it is important that health screening take place at the entry point, at the borders, at the airports, and so on. Now, let's see the second one as strategies that are used to address these health consequences when you have population mobility. Number 2 is better integration of migrants into the healthcare system. And so, when migrants move into a new, the host country should implement policies to integrate migrants, not only to integrate the migrants, to help them fit into the national health insurance schemes, making the healthcare more accessible to them, not isolating them and just leaving them to suffer, because if they do, very soon these NCDs will be spread. Now, will be, will become a very serious case. Going around and everybody becoming coming down with it, and very soon the host country suffer it as well. So policies should focus on overcoming the legal, linguistic, and also cultural barriers, so that it will ensure that this migrant receive the care that they need. If they get the care that they need, I think they will not only be serving and protecting the host country indirectly, they will also be taking care. They will not only be just taking care of the migrants, but they will indirectly be taking care of their citizens. Now, finally, is community-based health intervention. I told strategies for addressing the health consequence of population mobility. Finally, it is the community-based health interventions. Under this intervention, we have public health campaigns that are targeted at migrant communities, and this can improve health outcomes by addressing all those specific cultural barriers and also providing education about local healthcare access and the services that they can access. Additionally, promoting health lifestyle practices have a long impact in mitigating the adoption of harmful behavior. So when you give them appropriate education, it will promote their lifestyle, it will help them to make right decisions so that they can adopt better lifestyle, mitigating against all those harmful behaviors that a lot of persons tend to adopt, like smoking, taking Indian hemp, and hard drugs, and so on. Now, in conclusion, population mobility, whether driven by economic, political, or environmental or social factors, indeed has significant public health implications. Migrant populations indeed face unique health challenges, and no doubt about that, and I've told you reasons why. And their movement can alter a lot of health dynamics in both the origin and the destination areas. So effective public health strategies must consider migration patterns, cultural differences, and also the specific health needs of this migrant population as they come in. Because in doing that, it will ensure better health outcome for all. So we have come to the end of this particular discussion today, which is titled Population Mobility and its Health Consequence. Now remember that you should take note